Yeah, so I'm Riyadh. We're co-chair of London Bangladeshi Health Partnership, also AD for community engagement, vaccine equity, screening equity for NHS England and London. So I'm going to be talking about our work with the London Bangladeshi Health Partnership and also the vaccination and screening groups you may have been hearing, which are London-wide initiative of bringing place, system and region together with public health, the VCSE sector, faith sector, and also ICB colleagues, both in terms of co-producing resources, building trust, and also embedding vaccinations and immunizations into a life course approach. But I cannot underpin how important building of trust is and understanding what's really going on with communities and listening to them. So in the kind of wider context, you can see the kind of array of VSGs that we have: the London Bangladeshi Health Partnership, London Black African Caribbean Communities VSG, London Black Christian, London Black Muslim, London Pakistani, London Eastern European, London Somali, and Brazilian and Portuguese. And we're setting these groups have been set up as expert-led groups, trying to build confidence and addressing vaccine and screening equities. And we do that through engaging trusted leaders, trusted places, and trusted voices, and understanding and engaging with communities around their wider health concerns and the context of the wider health disparities. And obviously, vaccinations need to be an integral part of that more holistic health conversation. And as I said, it kind of brings everything together. There's a clear recognition that these particular communities, why we set up the group, there is low vaccine uptake, low screening, socioeconomic deprivation, pressures on housing as well, and as a result of that, we've prioritized these communities to work with, not to stigmatize, not to single out, not to target, but to work alongside. And it's really important, the language and how we approach it in terms of this kind of community centered. And as you can see, we're not just lumping religious communities together. We recognize that there are many Muslim communities in London, and but it's important to kind of work community by community, and to see that intersection of faith and ethnicity is really powerful and helpful. So as Professor Kevin Fenton says, trust, and it's absolutely right, trust equals truth times consistency times time. And it's really is the most important thing in building a friendship and building engagement with communities. So let me take you into a focus on our
Sorry,
VSG.
Riyadh. I'm just going to quickly jump in. Your slides aren't moving.
Oh, they're not moving. All right.
No. I don't know if you just want to click on yeah, we can see the trust slide now.
Okay. Sorry about that.
No worries.
Okay, yeah, great. So I just want to focus on the London Bangladeshi Health Partnership, VSG, now, and just the kind of reasons why it was formed. It was formed during COVID, when we realized in terms of Black and Bangladeshi communities, there was high morbidity, mortality, more disproportionate impact, but actually there was a lot of it shone a light in terms of the underlying health inequalities facing these communities, and as I said, compounded by socioeconomic deprivation and other factors, and intergenerational. There was a need to kind of look beyond just post-COVID in terms of post-pandemic, for us to have maintain that relationship with faith and community leaders and with those particular communities, so that we can now kind of engage on chronic disease and kind of work with the communities to address that and advance equity. And just in case colleagues are not aware, in London we have around about 320,000 Bangladeshis in London, and that's based on census, the last census. So in many ways, the London Bangladeshi Health Partnership, which formed during just after the pandemic, to kind of bring allyship with place, system, region, and those of us with lived experience and professional background, to become a trusted mediator and kind of connector. So we're like a bridge. The partnership is effectively a system advocate to the community and a community advocate to the system. So it's kind of important to understand it in that context. the areas that came up when we launched the Bangladeshi Health Partnership was looking at low vaccine uptake, low cancer screening uptake. In Tower Hamlets had something, I think it's female breast cancer screening uptake is 26%, which is really low. And also the kind of worsening high health inequalities. So these are the areas that the first summit focused on, and also looked at the kind of barriers and digital exclusion and mistrust and how we work, which is to kind of build trust with the community and also focus on those areas that are really key to them on a day-to-day basis. And diabetes was of great concern, and also the rise in diabetes in under 40s in the Bangladeshi population. And still maintaining that discussion on vaccination and building trust. So working closely with Tower Hamlets and Barts Health Trust, NHS England London, and Bangla Housing and Voice for Change England, a constellation of partners, were able to hold the first summit. That's probably London's first ever Bangladeshi Health Summit last September. And on the back of that, there's some work on with regards to diabetes insights for the Bangladeshi community in Newham and Tower Hamlets. This gives you an example of how London Bangladeshi Health Partnership and NHS England London are working together to produce co-produced communication that is tested by the community and designed for the community. And it's important to understand, as I said, the trusted leaders, who they are, faith community, where are the trusted places, mosques, women's groups, etc. And where are the trusted, and who are the trusted voices and channels. So, even I can say my retired father, GP, who's a GP over 30 years, but he does not watch any TV unless it's through the 7 or 8 Bangladeshi channels that are beaming out of London. So, and my dad's not dissimilar to many of the Bangladeshi community across the country. It's about 650,000 altogether, probably more in the United Kingdom. So Bangla TV, you need to get onto it, and you need to get those kind of trusted people to discuss those matters of health and holistic matters to do with vaccinations and screening in a TV format in the language. So I've had to brush up on my Bengali as well, albeit through a northern lens. But it's important to do that, and we're doing more of that, and we're doing that for all the VSG groups as well, as I mentioned, Black African, Somali, Pakistani. And if you'd like to get involved, if you're a member of the community, you're a professional, you're an ally, you work in public health or AXA, etc., and you feel that you'd like to get involved in any of these VSGs, including the London Bangladeshi Health Partnership, and please do reach me following this. And this is very much almost like a movement approach where we can work together downstream and upstream. This gives you some of the kind of flavors of some of the pictures of outreach work which the Bangladeshi Health Partnership have worked with delivery organizations to get closer to the community and deliver vaccinations, but also deliver discussions on cost of living crisis or things that are key to themselves, key to their well-being, and it's working again in partnership with colleagues across the spectrum, ICB, local councils. So that kind of partnership working is really important. That's a very important kind of aspect of the way that we all work with the VCSE, the ICB, the public health team, and the faith sector as well. And it's important also to recognize the language and have people that the kind of community can understand and look visibly Bangladeshi. And all these things are really important in terms of building trust and confidence. I'll give you an example of a community engagement group. We often talk about creative health, and creative health is very important. Every community, it's important to understand that one size does not fit all. So in terms of Bangladeshi community, what does creative health look like? What does good look like? What does that mean for other communities, etc. And so we're able to do that by in discussion with the community. There's a great love for culture at one end, and there's also spiritual and the religious dimension during Ramadan. So the Bangladeshi kind of life experience extends upon both of those ends. It kind of meets in the middle. So it's important to cater for both and to recognize, particularly through that kind of richness of our insights that we have given and we are connected with, that culture is really important, music, and as well as, taking ownership of health and kind of bringing the health to the community at a trusted place. So hence we worked with the cultural organization, brought health stalls, public health team, BARTS, London Bangladeshi Health Partnership, Wood Grange Medical Practice to a health event 2 weeks ago on a Sunday and a sweltering Saturday, actually, in Brady Arts Centre. And, we had a cultural program and health fair as well. And there you see Dr. Alam speaking extensively in Bengali, about how does not stigmatizing and not patronizing, but actually having a conversation with the community about this is the factual information about vaccine. This is how just a time for a reminder. This is how it works. This is how it's been tested, and this is how it's effective, and this is why it can protect you and your families. And it's really important for her to do that in Bengali to a overwhelmingly a 99% Bangladeshi audience. It was also good to see this newly appointed speaker there, because again these key dignitaries are trusted to the community and cabinet member for health for Tower Hamlets as well as our colleagues from BART and the council. The whole place was packed. The music was a great hook. There's a great love affair of the Bangladeshi, like all communities, towards music. And when you do it in the kind of Bangladeshi context, a lot of people are very interested. And the way that we wrap this into health and culture and arts is something that we couldn't have done had we not had this kind of organization like the Bangladeshi Health Partnership, which is that bridge to that. And just finally, I know this is not about Bangladeshi community, but it's just a bit of a plug in terms of how our vaccine and screening groups are working. It's important to kind of focus on our communities of Black heritage who are Christian, and the importance of pastors, as they are for imams for Muslim communities. Pastors are really important, and the networks are very, very key. So we have an ally in Pastor Nick Chandra in Enfield, who's from the Redeem Network, and he's opened his church for partners to come in. There'll be vaccinations, there'll be trusted conversations, and there'll be pastors and medical and nursing professionals of Black heritage that will be there to engage in conversations, not to speak at people, but to discuss with people and build trust. So forgive me, obviously you haven't been able to see the slides very well, but I think the kind of gist of the way that we're working is really actively listening to communities. One size does not fit all. Faith and community and ethnic culture intersect. Each community is in different ways. What is the sweet spot? Who are the trusted leaders? What are the trusted places? And how can we build trust through those particular community channels and voices? And in that effort, this is something for us all, allies and everyone, for us to kind of work together. And like I say, I'm at your service if you want to join any of these vaccination screening groups. But yeah, have a lovely summer, and thanks for your time and your patience.